everyone, welcome back to my channel Medicosguide. This is Dr. Ida Khan, and today we'll be talking about a very critical topic of suicide assessment and prevention for older adults. Older adults are often perceived as being in a stage of life marked by wisdom, reflection, and contentment. However, for many, this stage of life can also be accompanied by significant challenges, such as social isolation, chronic illness, and loss. And these challenges can increase the risk of suicidal thoughts and behaviors, which can be devastating for individuals, families, and communities. So let's dive into the details of this topic. The term suicide has Latin roots. It is derived from two words, su and side or sidium. The word su means oneself, and side or sidium means to kill or to harm. So this is an intentional act of taking one's own life. And in majority of the cases, this is because of psychological disorders. Now let's move ahead to find out more specific causes. First cause mentioned here is depression, and depression is a more common cause of committing suicide. Why so? Because depression can cause intense emotional pain. These individuals are overwhelmed by the feeling of sadness, hopelessness, and despair, and therefore they commit suicide in order to seek escape from their emotional pain. Depression can also impair cognitive function, making it difficult for individuals to think clearly and develop effective solutions to problems. Moreover, depression can lead to social isolation, reducing access to supportive relationships and increasing the feeling of loneliness. Now, psychotic disorders. Among psychotic disorders, schizophrenic patients are at the higher risk of committing suicides. Because in schizophrenia, there are some psychotic symptoms such as hallucinations, delusions, and disorganized thinking, which can contribute to suicidal thoughts and behaviors. Furthermore, schizophrenia can also cause cognitive impairment and social isolation. Now, impulsivity. Impulsive behavior is when you act quickly with no thoughts to consequences. So, such individuals act on emotions. There is lack of self control, making it more difficult to resist suicidal impulses. There is also increased risk taking. Impulsive individuals may engage in riskier behaviors, including substance abuse, which can increase the risk of suicidal behaviors. A cry for help. A cry for help can be a desperate attempt to communicate unmet emotional needs or to seek attention and support. Individuals may feel overwhelmed by their emotions or circumstances and may not know how to cope or seek help. A cry for help can be a maladaptive attempt to communicate distress rather than using more effective and healthy communication strategies. Now, terminal illness. Individuals with terminal illness may fear experiencing unbearable physical or emotional suffering, leading them to consider suicide as a means of escaping their pain. Terminal illnesses can lead to a loss of autonomy and independence, which can be distressing and contribute to suicidal thoughts. Terminal illness can also prompt existential concerns, such as fears about the meaning of life, the afterlife, or the impact of one's death on loved ones. Now let's talk about common methods of committing suicide. These are gunshots, substance abuse, poisoning, hanging, jumping from heights, suffocation, electric shock, drowning, and carbon monoxide inhalation. Now let's move on to the stages of suicide. Suicide is comprised of three main stages, and these are ideation, threatening, and attempt. Let's discuss them one by one. Now, the first stage is suicidal ideation. Suicidal ideation refers to the process of thinking about, considering, or contemplating suicide. Individuals may experience recurring thoughts of death, suicidal fantasies, and a preoccupation with suicide. Individuals can be triggered by various factors such as mental health conditions, substance abuse, trauma, or significant life changes. Now, the next stage is threatening. Suicidal threatening refers to the verbal or behavioral expression of suicidal intent, such as making threats or statements about wanting to die. Individuals may make implicit or explicit threats, such as saying, I'm going to kill myself or I wish I were dead. Threatening behavior can be a warning sign for a potential suicide attempt. Now, let's talk about the last stage of suicide, that is, a suicide attempt. A suicide attempt is a non fatal, self inflicted injury or poisoning with the intent to die. Attempts can range from mild to severe and may involve various methods such as overdose, cutting, or shooting. Previous attempts, mental health conditions, substance abuse, and access to lethal means can increase the risk of a future attempt. It is important to note that these stages are not always linear. Individuals may move back and forth between them. So, we should identify the warning signs and provide support to them in order to prevent suicidal attempts. Now, let's talk about epidemiologic considerations, and you will be shocked to find out how many lives are lost to suicide every year. According to World Health Organization, this is 1 million lives, which is even more than homicides and killing in the wars combined. And since suicide is a leading cause of preventable death, we should identify such individuals and help support them. Now that's all for today. There's more to explore in the next part of this video, so be sure to stay tuned. And if you found this video helpful, please consider liking, sharing, and subscribing for more informative and engaging content. And lastly, I want to say that break the silence surrounding this issue and promote the culture of open conversation, empathy, and support to prevent suicidal behaviors. Thanks for watching.